Okay. Hello. Welcome everyone that has waited. We apologize for the delay. We have our doctor on screen already, Dr. Tinonso Ifedozie. Thanks for joining us tonight, Doc.
Yes,
Quickly
thank you.
with me. Sorry. Okay, quickly with me. Just be okay. So with me on screen is Dr. Chinonso Ifedozie from Aguleri in Anambra State. I got that right. There.
Yes, yes, yes.
Okay. Okay. So Dr. Ife Dozie is a resident doctor in obstetrics and gynecology with Life International Hospital in Newi, where they major in fertility, assisted reproduction, women and child's health. He graduated from Chukwuemeka Odumegu Ojukwu University Teaching Hospital, Oka, and his life here with us tonight. Please, can you join me as we welcome Dr. Chinonso Ifedozie? Type in the comment section if you are live with us. Please welcome Doc with me. Thanks for joining
You're
us.
welcome. You're welcome.
All right. So quickly, we are going to dive right into the conversation. We'll be sharing on preparing for a baby, status and genotypic compatibility. That's for couples that are married now and are considering having a child. And so the first question I would love you to answer, Doc, is this. Generally, before marriage, right, couples are advised to do a blood work to get to
Yes.
know their genotype, their blood group, and the rest. Now, from a doctor's perspective, can you just briefly share with us why that counsel is important and why they should take it serious? Just that, basically.
Okay. Welcome, our viewers. My host has already introduced me. Um, in premarital screening, we call it premarital screening.
Okay.
Series of things that we do before um, marriage can happen. Some institutions, like some churches, is compulsory in some churches, but the list of tests and the list of investigations that they do differs, and it depends on different religious institutions. But there
Yeah.
are the basic ones that you must do to avoid entering into trouble. Um, so uh, it's very important for both parties. Understand one of the first reason why you must, I say it's a must, do this test are it allows for early detection and treatment of diseases. Like there are people that it was during their premarital screening that they found out that they were HIV positive. There are people that have
Wow.
hepatitis B, hepatitis C, and some persons it was even during their premarital screening that they got to know their genotype and their blood group. So it's
Yeah.
actually very, very important. Some people never visited the hospital except until they were planning to get married. So you can see how important it is. So it's very important. And also, the second reason why it's important is for informed decision making. Um, like, let's assume now that I have hepatitis B or HIV and I want to marry someone. So without doing those tests, the person will not know. And the person might marry me out of ignorance. And um, they say that any marriage that is based on deceit is already null and void even before it started. So it's actually very important for informed decision making. If you're going into that marriage, um, you already know your partner's status, the viral status, and the basic health information you need to know about your partner. So any decision you're making to live with that person for the rest of your life is a well informed decision. So that's the second most important reason. Then the third reason is that it reduces the risk of transmission of diseases. Like if someone is HIV positive or hepatitis B or hepatitis C positive, and or syphilis positive, um, if there was no premarital screening, the person can enter into that marriage and start infecting the partner, even without him and he or she and the partner knowing. So it's actually very, very important. And then without those screening, you can't get to know these things. Another one is improved reproductive health. There are some persons that will get married and they will stay like 1 year, 2 years, 3 years, 4 years, 5 years without getting married, without having a child, or without the woman getting pregnant. And they can't even point at one particular thing that this is actually the problem why we don't have a child yet. But if there was a premarital screening exercise or test, it can like let's assume the man doing an SFA, seminal fluid analysis. It will help the person to know, okay, I have an issue, I need to deal with this thing before I get married. So it's actually very, very important. So basically these are the four most important reasons why um, premarital screening is very important. It's important for both parties and also for the person in particular doing that. So I hope I'm
Okay.
clear. I hope I'm clear.
Yes, yes, yes. I appreciate the fact you mentioned that some persons don't even get to know the status of their spouse until the point of marriage.
Even
And many a
themselves,
times,
even themselves,
okay, okay.
yes,
So it's important.
even themselves, yes,
Okay,
very, very important.
okay. Now you mentioned that one of the reasons is to know your blood group and your genotype. Many a times people don't, there's no opportunity for them to get to know until they get to that point.
Yes,
Okay. So speaking of this genotype now,
okay.
speaking of genotype, right? Now I understand that, well, whatever your blood group, it doesn't stop you from getting married, right?
Exactly, yes. Yes, it does
Okay.
not.
Okay. But it will affect the decisions they make when it comes to having a child.
Exactly.
Okay. Okay, so let's take the scenario of phenotype and resource factor. Okay, first of all, give us a background information on what resource factor means and how it affects pregnancy.
Okay. So we have what we call blood group and genotype. So there are two
Okay.
different things. Some people don't actually know what it is. So, but I will just give you a simple definition, a layman's term of what genotype and blood group is. So,
Okay.
for genotype, you understand, genotype is actually, um, how do I say it now? Is the complete set of genetic information concerning a particular organism, like a complete set of genetic information, everything that concerns that person genetically. So that is genotype. But for blood group, people are classified, blood group are classified based on certain factors. Understand? Many people have different blood groups. So, and for you to actually know your blood group, you have to go for a test. So, blood group are classified based on the presence or absence of certain antigens in the surface of the red blood cell of that particular person. I don't know if you understand. So, persons are classified. Blood group are assigned based on the antigens present in the surface of the red blood cell of that individual. So we have many blood groups. We have the ABO, we have other blood groups that are that are rare that we don't talk about, but they exist. So the
Okay.
ABO blood group, you know, the A blood group, the B, the AB, the O. So we have others like the Duffy, the Kerr, the Bombay, and the Rhesus, many of them. But the most important and also rhesus factor. The most important is the
Okay.
ABO and the rhesus.
Yes.
Do you understand? So the ABO, if there is a antigen in the on the surface of the red blood cell of that individual is now is A, um, has blood group A. So the positive that comes there depends on the rhesus factor of that person. I don't know if you understand.
Yes, sir.
So it depends on the rhesus factor of that person. So and rhesus is an antigen that is found on the red cells, on the surface of the red cells of certain of individuals. So and they have genetic undertone. Okay, they have genetic importance. Can you hear me?
Yes, yes, I'm with you.
Okay. So, so they have genetic importance. So if an individual is that there is no rhesus antigen on the surface of the red cell of that individual. But if the person is rhesus positive, there is a rhesus antigen on the surface of the red cell of that individual. And what are the importance of this rhesus factor? Very important. Number one, as per okay. So it's very. Can you hear me now?
Yes, 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 I'm with you.
Okay, okay. It's very important. Generally for blood transfusion, it's important in premarital screening as it is an important factor in caring for the unborn child and also for the
Okay.
woman. So let's assume a woman is rhesus negative, whether your blood group is A, O, A, B, B, and you're rhesus negative as a woman, and you marry a rhesus positive man, there are certain things that you do. They are not. It's not a total contraindication for that for those persons not to marry. It's not. They can marry
Okay.
because there's a solution for that. So if the woman is rhesus negative, whenever there's what we call sensitization. If the man gets the woman pregnant as it should be, the first child, the first pregnancy of that woman, if the blood group of that baby inside is the blood group of the father, the first pregnancy there is no problem. There usually is no problem because there is no sensitization yet. For subsequent pregnancies, if that antigen, because there is an antigen and antibody reaction, once the blood group of the man is introduced into the system of that woman, there's an antigen antibody complex that is formed that keeps on killing the subsequent babies of the subsequent pregnancies, keep on terminating the subsequent pregnancies or causing damages to the live babies of that woman. So if they are not neutralized, if the antigen antibody complex are not neutralized, the woman will keep on having issues. So it's actually very, very important for every woman, especially women, to know their blood group and their rhesus factor before entering into any marriage. And there's a big mistake that young people make. You see people that do that indulge in induced abortion.
Okay.
Abortion generally is not um, is not legal in Nigeria. It's not legalized in Nigeria. So,
Okay.
but some people still do it at the backyard. So we have to inform them. We have to talk to them about it. If you're a rhesus negative person, for each abortion, so far the pregnancy was from a rhesus negative man, a rhesus positive man, sorry, you must have to take something we call rogam. That rogam is will neutralize the already formed antigen antibody complex in that woman's blood. So you must take that rogam for you to. So the rogam is taken after every live birth or after any miscarriage for that
Okay.
woman, for that negative woman.
Okay.
Some persons will tell you that you must test the blood group of the child if the child is born alive before you give rogam. But what about in cases of miscarriages where you don't
Okay.
have a way of testing
That was not
the
born.
blood group of the child?
Yes.
Exactly. So it's very, very important for you to take rogam if you're a rhesus negative woman that is married to a rhesus positive man. If in cases whereby it is the man that is rhesus negative and the woman is rhesus positive, it does not usually do anything. Um,
Okay.
the reactions and complications are actually very rare. They
Okay.
are not total that it does not happen at all. They are rare. It happens, but it's once in a while. The most important is when the most important is the woman's blood group and not actually the man's blood group.
Okay.
So then okay, I think I've answered your question. Like we're not talking about
Yes.
genotype yet, right?
Yes. 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 You've answered the question. So I want to clarify something. How about a resource negative woman that gets married to a resource negative man? In that marriage, when they are having children, would they have any issues?
Um, they are rhesus compatible couples now. So the woman is rhesus negative, the man is rhesus negative. So there won't be any antigen antibody complex
Okay.
that will be formed. So
Okay.
if the woman is born in the anyway, I'm not talking about faithfulness, but if you're very sure
Okay. Okay.
so I was saying something. If you're very sure that it was your husband that is the father of the unborn child, so there won't be need for any injection,
Okay. Okay.
any injection that will neutralize the antibody because you guys
Okay.
are rhesus compatible. Like you don't have
Okay.
any issue. So
Okay.
except when the woman is negative. So there are some myths that people have about this rhesus incompatibility. Number one is that they say that it comes with a lot of complications. But if you find out that you're rhesus negative as a woman and you your pregnancy was well managed, you are very very religious with your antenatal visit, so your doctor will tell you what to do about comes down with serious complications newborn. whereby the child will have jaundice, anemia, and all that. So these are
Okay.
some of the complications of rhesus incompatibility. So,
Okay.
and there's another thing that scientists will tell you that it's only first time pregnancies that rhesus factors come into play, but it's not true. So rhesus factor comes into play for all your pregnancies, not only the first pregnancy. So because the blood group, it cannot change. It's inborn, it's what you already have. So it can't change in subsequent pregnancies. So it's always there. So it doesn't go away after your first pregnancy. So
Okay.
then another thing is that they say, and this resisting compatibility, it can cause birth defects, but it's not true. It's not totally true. It doesn't cause any anatomical effects to the baby. You understand?
Okay.
But it has
Okay.
some complications, which I've mentioned before. The hemolytic disease of the newborn, erythropoiesis fetalis, and all that. So, um, but it does not cause any physical or any anatomical effect, birth defect on the baby.
Okay.
So, then another okay. Then another thing is that some people will tell you that genetic rhesus incompatibility is a genetic disorder. So I've come to tell you that it's not a genetic disorder, it's a blood group stuff. So it's not a genetic disease. Like some people will tell you
Okay.
that they will start, you are rhesus negative, I can't marry you, it's a genetic. No, it's not. So
Okay.
it's, in fact, we call them special people. You understand? So we call them special people. They are so it's not a genetic disease. That's what I'm trying to say. So, and then another thing is that some people will tell you that it always requires surgery. That if once you're a rhesus negative woman, whenever you want to give birth, it must be through CS, but it's not true.
Okay.
Rhesus negative or rhesus compatibility is not a an also absolute indication for cesarean section, except if there
Okay.
are other reasons why the woman must undergo cesarean section. Rhesus incompatibility is not an indication for cesarean section, except when the if there are other indications, then it can happen, but on its own is not an indication for cesarean section. So
Okay.
then another thing is that sometimes it affects the mother, because it's the mother that is carrying the antigen antibody complex. So, but it's rare. The immune reactions that happen is actually rare.
Okay. Okay. Thank you very much,
Okay.
Doc. Oh, no, no, no. Thank you very much, Doc. So I wanted to
Okay.
just go through what you said, right? Resource
Okay.
incompatibility simply means when both couples are not the same resource factor, like O positive, A positive, and the rest, right?
Yes.
Okay, and then it is not an indication not to get married.
It's not at all. It's not.
Okay, okay, but for resource negative moms or for resource negative women now in marriage, there is a drug they need to take
Exactly.
from as early as when? Is it the first pregnancy? At what time in the first pregnancy or for subsequent pregnancies? How
Okay.
soon during the
It can be
interval?
taken from 24 weeks of that pregnancy, but um, what we usually practice is immediately after delivery, because the standard is you must give that woman, you must neutralize that antigen antibody complex within 72 hours of delivery or miscarriage. So the woman must take that injection within 72 hours of delivery or miscarriage.
Okay, is
So
it
even
for the
if the
first
woman did not take it during pregnancy, even if the woman did not take it during pregnancy, the woman has a chance of taking it immediately after delivery, but it must be within 72 hours before there will be sensitization, because once there is sensitization, there's already an issue. Desensitizing that woman is almost impossible.
Okay, sorry, let me get this clearly. This is after the first pregnancy or first miscarriage. Hello, doc, can you hear
Hello,
me?
sorry. Yes, sorry.
Okay. So I said,
I can hear you. Sorry, a call came
sensitization.
in on my phone. Yeah, I
Okay,
can hear you
okay,
now.
okay. So I was
Yes.
asking, sensitization for the woman, is it immediately after the first pregnancy or first miscarriage or subsequent pregnancies and or miscarriage rather?
Okay. The sensitization happens first pregnancy. There won't be sensitization. Like
Okay,
there's always no there are always no issues with first pregnancies. But because the antigen antibody complex has not been formed yet in that
okay,
woman, so it's
okay.
basic incompatibility usually affects subsequent pregnancies, not the first pregnancy. So I
Oh,
if remember what I said, I mean pregnancies. I didn't say live births. I said pregnancy. So even if the pregnancy ended in a miscarriage, the woman must take that um, program, that drug.
okay, okay,
So the person will tell you that they are raising negative, but they don't have any live child. They don't have any living child. That all their pregnancies have been miscarriages. You understand? So
okay,
it's not a reason not to take the. So once the pregnancy is from a rhesus positive man and you're rhesus negative, you must take that drug.
okay, okay. I think that's clear now.
Yes.
Thank you very much, sir. So quickly, I would love you to also share on genotype because we just talked about blood group and resource factor. Now for genotype,
Okay. So okay. Um. So okay. Want to talk about genotype? Genotype is another test. Is another thing. Um. As we say, is the genetic complete genetic information of an individual or an organism. So far the person thing is a living organism, they always the person must have a genotype. So
okay,
there are different genotypes we have. We have the normal ones, the AA, the AS, the SS, and all that. Then we have the very rare genotypes, the SC, the AC, and that. So for the genotype is a very, you asked me whether blood group is rhesus incompatibility is an indication not to get married, is a reason not to get married. I said no. But for this genotype, it's actually a reason not to get married. I'm talking from a medical point of view. I'm not talking
okay,
about spiritual stuff. So
okay,
for genotype, we have the AA. We all know what it is, the AS, the SS, the AC, and all that. So for marriage, for people that want to have a child, for marriage and all that, it's very important. If you're AA is like a universal recipient or something. I don't know how to say it, yeah. But if you're AA, you're free to actually marry any genotype. You understand?
yeah,
But if you are not AA and you're AS or any other genotype, you have some restrictions. Can you hear me?
yes, yes, I'm with you.
Can you hear me?
Yes, Doc, I'm with you. I can hear you.
I'm coming. I'm coming. So it's actually an if you don't, if you are not, so let's let's do it this way. If you're a woman and you
Doc, I'm with you. I can hear you.
can you hear me now?
Yes,
Okay.
yes, I can.
So I said if you're a woman and you're AA or a man and you're AA, you can actually marry any genotype. Oh gosh.
I can hear you, Doc.
You can actually marry any genotype. But if okay, but if you're AS or SS, you have some restrictions. So if AA marries AA, definitely if the children are coming from the man, if they are from the man and the same man and from the same woman, all the children will be AA. AA versus AA is very much acceptable. But AA versus AS is very much acceptable too. Because in AA versus AS, there is zero chance of getting a sequela or a child that has SS genotype. The chance of getting a child that has SS is zero. I don't know if you
Okay.
understand.
Yes, yes, I'm following.
Okay. The chance of getting a child that is SS is actually zero because the disease is, comes in an autosomal recessive pattern. You understand? Before the disease will show, there must be two unacceptable genes for the disease to show. So if the person is AS, there won't be any sickle cell traits in that individual. There must be two recessive genes for the disease to show in that individual. So if a woman is AA and the husband is AS, they and the intending husband is AS, they can marry. There is no issues.
Okay.
They have children, and AS children. But in situation whereby the man is AS and the woman is AS, the chances of getting a sickler for each pregnancy is 25%. That is 1/4. So there is where some confusion comes in some person's brain. Some people will tell you that I'm so much in love with this person, I want to marry this person, he's AS and I'm AS, so we can
Mm-hmm.
marry. We will just give birth to three children because it's the fourth person that will be
The fourth
SS.
one.
But it's not true. It's not true. It's not the
Yeah.
fourth child that will be SS. That chance, that 1/4 or that 25% is for each pregnancy.
Wow.
So it's not like you want to cheat nature, you want to cheat science. You will now give birth to first child,
Yeah.
second child. The first child will not be AA, second child AS, third child AS, the last one will now be SS, and you now stop giving birth after the third child. It's not true. You might be very unlucky and all your children might be SS.
Wow.
Yes, and you might be very lucky because some persons will hear this and they will be like, ah, I know some couples that are married and both of them are AS and they don't have any sickle in their family. is actually very um, is very possible. You understand?
Okay.
Because the chances of getting a sickler or getting an excess person is 1/4 for each pregnancy.
Okay.
So after each pregnancy, the chances recess. Do you understand? So there is no
Yes.
carryover. There's no carryover. Like I've done 1/4, I've done 2/4, I've done 3/4. So 4/4 will now be sickler. It's not true.
Okay.
So basically that. So
Okay.
then the other rare genotypes like the AC, the SC, is still the same thing. You
Okay.
understand? If you're AC and AC versus AC, you are not advised to marry. So and
Okay.
what is this sickle cell that we're talking about? You know it's a point mutation.
Yeah.
You understand? Hmm. On chromosome 11, position 6. You understand? So whereby the chemical acid is replaced with valine. So so that's what happens is that the person's the shape of the person's red cells, because it's actually the red cells that is the major problem in all these things that we're talking about. The genotype,
o-
the blood group, it's actually the red cells that are implicated in all these things that we're talking about. So
Okay.
their red cells are sickle shaped. And what happens? How do they have issues? How do they have symptoms? That red cell, because of the shape, because normal red cell is disc shaped. You
Yes.
understand? It's biconcave disc shape. I don't know whether you understand what is biconcave this shape. That shape,
Yeah.
like I don't know how to draw it, but it's like
Yeah.
this.
I
So the
understand.
biconcave disc shape helps it to meander. You understand?
Yeah.
Through the blood vessels. But the sickle shaped red cells, they can't meander through the blood vessels. As they are trying to pass, to squeeze themselves to pass through the blood vessels, most of them are killed.
Okay.
Understand? Most of them get hemolyzed, like they are destroyed. You understand?
Yes,
So,
sir.
and normally the lifespan of a normal red cell is 120 days. It's actually 90 to
No.
120 days. But for a sickle cell red cell, the lifespan is actually 10 to 20 days. So
Wow.
you can now see why most times they come down with anemia. You understand? Because there
Okay.
is frequent
Okay.
hemolysis, frequent destruction. What do I mean by
Yeah.
hemolysis? There is frequent destruction of red cells in that person's body because of the shape. Because the shape of that red cell is not designed for our blood vessels. So they are easily destroyed as they are trying to move inside the blood vessels.
Okay. Okay. Thank
So do
you
you
very much.
understand?
Yes. Yes, I understand that. Thank you very much, sir. So, but I still like to know because, like you said, some people will still get married despite being advised not to because of their genotype.
Okay, you say what?
I said, I'll still love to know what to do in cases of people that
Okay.
still get married despite being advised against it because of their genotype. What options do they have when it comes to childbirth?
Okay. Um, when it comes to childbirth, for people that maybe they married due to certain reasons, they married out of ignorance. You understand?
Okay. Yeah.
Some persons that married out of ignorance, maybe they didn't do any premarital screening, no premarital screening test was done before they got married, or people that were giving fake lab results by lab scientists. Because some persons will connive with lab scientists and they will, because of their desperation, they are very desperate, they are so too desperate to get married to that particular person. They will now go and connive with the lab scientists or the lab people to
Yeah.
give them fake
Late
results.
result.
You understand?
Yeah.
In
Yes.
cases like that, or people that don't know, they have innocent mind, they did not do any wayo, any ojoro, they were just giving fake or wrong lab results by lab scientists. So there are options for giving birth to people, to children that are not SS. You understand? So there are different options. So because currently in Nigeria, abortion is not legalized. Some persons will tell you, doctor, if I conceive and I will check the genotype of the baby, maybe through PCR or through any other means, genetic testing. Can you hear me? Hello?
Doc, can you hear me?
Yes, I can hear you.
Okay.
Sorry,
My
I can
network
hear you
slipped off.
now.
So you were
Okay.
saying concerning those persons that still get married despite being advised against it. What
Exactly.
options do you have?
Yeah, so they have options. The world is medicine is actually going to another level now. Um,
Okay.
gone are the days when people will say that they are when you call someone a barren woman or something. So no woman should be barren in this 21st century now, because there are many options for the woman to get pregnant. There are many options to
Okay.
have a child that are legal, that are
Okay.
legit. So
Okay.
in cases of ignorance or stubbornness and they still got married, so they can do genetic testing for each pregnancy to know whether the child is to ascertain the child's genotype or something, but it's not frequently done in Nigeria. It's not routinely done in Nigeria. So the ones we have in the country is that is we have options
No, it's not.
like I we have options for assisted reproduction. Well, let me just call it assisted reproduction, surrogacy, adoption, and many others. You understand? So, um, can you hear me? Can you hear me? So, can you hear me?
Hello, Doc. Can you hear me?
Yes, I can hear you now.
Can you hear me, Doc?
Yes, I can hear
Yes, you can.
you.
Sorry, Doc, I'm with you.
Okay, can you hear me now?
Yes, 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 I'm with you.
Okay, so we have options for them. All hope is not lost. Maybe you mistakenly got married to you guys are incompatible when it comes to your genotype. There is still hope for you to have your own child or have children that are not
Okay,
SS. You understand?
okay,
So
okay,
the options are assisted reproduction,
okay,
IUI, IVF, surrogacy, adoption, and all that. So it depends on, but they actually need proper counseling because it's not something that the person will accept just like that. They
okay,
actually need proper counseling from the doctor or the healthcare professional that is seeing them or that is counseling them.
okay,
So there are options. There are options to have your own child or to have children if you are genotypically incompatible.
okay. So when you say IVF for for a couple that is genetically incompatible, what does that look like?
Okay. For IVF, you know what is IVF? IVF means in vitro fertilization, right? So
Yeah.
where the child is not fertilized, the pregnancy was not fertilized inside the woman's body. The pregnancy is fertilized in the lab. That's in vitro fertilization, fertilization outside the body. So what happens in IVF? Some persons, you have an option of um, having a child, but I it's basically what I cannot say in an open air like this now. Um,
Okay.
but there are options.
Okay.
Yes, there are options for that. Very good
Okay.
options. Yes.
Okay. Okay. So I guess for everyone who is interested in understanding how that works, they'll have to revert to you privately or
Yes, yes,
discuss with their personal doctors.
yes,
Okay.
exactly, exactly.
And you mentioned that adoption is also an option, right?
Yes, yes.
Okay.
Adoption is if handled in a proper way, is a legal thing and is a good thing. Um, except that in some cultures is still gaining acceptability. Like it's still not yet totally accepted in some cultures, but it's still an option, a very good option.
Okay.
So you have a proper way of adoption. We have a legal way of adoption. Understand? Not going to carry a child. Maybe you now face. You know what we call human trafficking. They will just pack some young girls somewhere, and those people will be giving birth anyhow, and they will be selling those babies. So those ones they are
Okay.
illegal. They are illegal. But adoption on
Okay.
its own is part of assisted reproduction. The person is legal, and if followed in a proper way, in a legal way, is a good thing. So,
Okay.
and I tell people that some persons will be like, that everybody will know that I am not the mother of a child, I'm not the father of a child. But
Mm.
human being is made up of 80% of environmental factors and 20% genetic factors. So persons resemble or adapt to the environment where they are raised. You understand? So adoption is a very good option for persons maybe that have. It's actually most times actually the last resort. It's actually the last resort, but it's still a very good
Okay.
option if followed in a legal way.
Okay. All right.
Yeah.
Thank you very much. We'll be rounding up here because of time. And also, we had a lot of network interruptions this evening. So, I don't know if there are questions from the audience, but if there are any, please, I would love to have them at this point. Okay. And then for everyone, who has joined us on this live. Thank you so much. Please, our doctor, Dr. Chinonso Ife Dozie, is available for private consultations for persons that are interested. We'll put out his contact on the link of this video in the description box. So you'll be able to reach him if you want to get private consultations with him. I hope that's clear. Doc, please, before we leave you to go, is there anything you'd love to tell us in a wrap? Sorry, I did mention something. Our doc is actually from Anambra and still resides in the East. So I don't mind you telling us in your local dialect. What is your advice to singles who are getting married concerning this conversation? What should they know? Please, you can tell us in your local dialect and interpret it for us. And then for married couples too, who are in this situation, what would you advise them to do?
Okay. There is what our that's how our people used to say it, that Mgbe Chikadi. That's my own local dialect.
Okay,
Um, because so it means make hay while the sun shines.
okay,
So and always do the right thing at the right time. Don't try to
yeah,
maneuver things because at the end of the day, it will still fire back. It will still tell on you. I mean, for some
okay,
persons that will go and that will go and connive with lab scientists and they will give them fake or altered, adulterated results. So it will still
okay,
show. Still show. So you
okay,
know you can't run away from it. So my advice is that in this 21st century, premarital screening tests are is a must for every intending
okay,
couple. You understand?
okay,
You have to know the genotype, the blood group, the viral status, and other things, other relevant things, health information that you need to know about your intending partner. Is actually very, very important. You understand?
okay.
If our fathers in the olden days, we can forgive them about should miss that. And I know some churches, some churches now so basically that. Then for people that have already made the mistake, there is still hope. Your options are plenty. Your options are many to still have your own child. You just have to meet the right people, meet the right medical personnel. Um, they will guide you on how to go about it. But your options are still many. You understand? So you
Okay.
still have hope. Your hope is still plenty. So
All right. All right. Thank you very much. Thank you very much. Please, for privacy's sake, we won't be displaying the contact of our doctor on screen. So, but for persons that would love to reach out to Dr. Chinonso Ife Dozie for private consultation, please, we would love you to join our community. We have a community of nursing moms, pregnant women, and women that are expecting. The link is on the screen. Please join the community and you have access to the doctors from that community. He's very accessible, but we may not put him out there openly. So that is what we can do from our end. And so, Doc, thank you so much. Thank you so much for this interview. Thank you for your patience. I really appreciate it big time. And so I
you're
hope
welcome.
we will get to do more together, still in this journey of pregnancy, childbirth, and what women
Sure,
that are in this
sure,
season should know. So we
sure,
will leave you to retire for the night. Thank you very much, sir.
sure.
All right. That will be all. Was he saying something? Okay, that'll be all for tonight. Thank you for joining. For everyone that joined, please share the link with everyone you know, every nursing mom, every pregnant woman, every expectant woman, especially for every expectant woman, right? Share this link with them and let them get this information as soon as possible so that they make the right decisions while preparing to have a baby. So that'll be all from me tonight. See you next week, Saturday, 8 p.m. on the next conversations with the Ask a Doctor series. Thank you.